Hello, and thank you for your interest in the Family Nurse Practitioner Specialty Program at Vanderbilt University School of Nursing. My name is Dr. Julia Steed, and I have the privilege of serving as the program's academic director. In this presentation, I will provide an overview of who we are, what we do, and how we prepare family nurse practitioner students to enter the healthcare workforce as competent, confident, and effective advanced practice providers. Let's begin by talking about what makes Vanderbilt University School of Nursing truly unique. We call it the Vanderbilt Advantage. For over 100 years, Vanderbilt has been a leader in academic excellence, building a reputation as a top institution for nursing education. By becoming a Vanderbilt University School of Nursing student, you are joining a legacy of excellence committed to making a difference in local, national, and global communities. As a Vanderbilt University student, you will have access to a wide range of wellness and health resources that create a comprehensive network of care. The Student Care Network is your primary access point for these resources. You can explore more details about the specific services available by visiting their website shown here. They serve as a central hub for connecting students to the right support resources. Additionally, you will have access to the University Counseling Center, Student Health Services, and the Center for Student Wellbeing. I also want to highlight Vanderbilt's Student Access Services Office. This office is dedicated to ensuring that students with known or suspected learning accommodation needs have access to an equitable and supportive learning environment. Our family nurse practitioner faculty members are a cornerstone of the Vanderbilt Advantage. They bring a wealth of experience and expertise to the program, creating a dynamic learning environment for our students. All of our faculty members are actively engaged in clinical practice, ensuring that the education you receive is grounded in real-world, up-to-date clinical knowledge. Our dual roles as educators and advanced practice providers allow us to effectively bridge the gap between theory and practice. As a family nurse practitioner, you'll have the privilege and responsibility of caring for patients across the lifespan, from infancy through older adulthood. Your role will involve identifying, diagnosing, and treating both acute and chronic healthcare needs, as well as providing comprehensive care that is inclusive of all populations and tailored to diverse needs. Our curriculum at Vanderbilt is designed to prepare you for this broad scope of practice while emphasizing a holistic approach to care. This includes not only diagnosing and treating illnesses, but also empowering your patients to lead healthier lives by integrating health promotion and disease prevention strategies into your practice. In addition to the principles we've just discussed, family nurse practitioner education emphasizes the importance of building long-term relationships with patients. These relationships promote comprehensive, continuous care and are essential for managing chronic health conditions effectively. As a certified FNP, you will be trained to serve as a coordinator of care to ensure that your patients receive seamless access to additional healthcare services when their needs do extend beyond your scope of practice or expertise. Family nurse practitioners are highly sought after because of the versatility of the role. FNPs can work in a variety of clinical practice sites. Many of these settings are listed here, but it is important to note that FNPs are also equipped to work in some specialty areas, but that is depending on their training and, of course, their interests. While the FNP certification offers tremendous flexibility and is not tied to a specific setting, it is important to recognize the boundaries of the FNP scope of practice. There are certain roles that fall outside of the educational preparation of an FNP graduate. These roles typically require specialized training, certification, or additional hours of shadowing. There are multiple pathways to enter our FNP program, and the diagram on this slide illustrates those options. You may enter with a non-nursing bachelor's degree, a bachelor's of science in nursing degree, or a nursing-related master's degree to complete a postmaster's certificate. Ultimately, the outcome of our academic program is the same, and all students graduate having achieved the competencies required for entry to practice as a family nurse practitioner. Multiple entry pathways also exist if your desire is to graduate with a Doctor of Nursing Practice degree. More detailed curriculum plans can be reviewed on the VUSN FNP program website. And although the Master of Nursing program is full-time listed here, students may choose to change their status to part-time for the remainder of their program at Vanderbilt once that portion of the curriculum is completed. Let's talk about the admissions process for our Family Nurse Practitioner program. Admission is highly competitive, and we take a comprehensive approach to evaluating each applicant. The admissions process begins with an evaluation of your GPA using all submitted transcripts. Following the GPA review, faculty perform a holistic evaluation of each application. This means we go beyond transcripts to assess your essay responses and how well your articulated career goals align with the FNP specialty scope of practice. We are also interested in how your demonstrated commitment is to VUSN's mission and values. Your application is an opportunity to highlight the skills that will help you succeed in our accelerated program. Space is limited in our FNP program each year. Therefore, you may receive an offer to be placed on the wait list. If you do receive this offer, please accept in a timely manner so that we have the opportunity to notify you of an opening as the admission cycle progresses. The FNP curriculum is composed of 45 credit hours, with the focus being on the delivery of primary care across the lifespan. It includes didactic, clinical, and laboratory courses focused on the scope of practice for the FNP. There are no courses currently offered that address subspecialty areas such as dermatology or cardiology, and electives that are available do vary from semester to semester depending on faculty and student enrollment. Our gap analysis process provides flexibility for postmaster certificate applicants who may have already completed key foundational courses in a Master's of Nursing program or have relevant professional experience. If you have previously completed coursework in pharmacology, pathophysiology, or in physical assessment, you have the opportunity to submit your syllabi for review. For actively practicing APRNs, these 3P courses may be eligible to be waived, which definitely streamlines your plan of study. A sample curriculum study is available on our website for you to refer to. However, each student does receive an individualized plan of study tailored to their unique educational background and program requirements. Our FNP program is designed as a hybrid model, which combines the flexibility of virtual learning with the benefits of in-person engagement. This approach provides a well-rounded educational experience that accommodates busy schedules while still offering opportunities for hands-on practice. A key feature of this hybrid program is the required intensives or block weeks. These blocks typically last 2 to 4 days and involve a blend of on-campus and virtual sessions. During these intensives, you'll engage in a flipped classroom format that maximizes active learning. It features interactive simulations, case-based discussions, and practical skill building. It is important to emphasize, however, that the rigor of the program for full-time students requires a significant time commitment. To be successful, you'll need to dedicate the equivalent of a full-time job, full-time employment hours to your studies. Balancing these activities with other responsibilities requires careful planning and a commitment to your professional growth. Our program offers a part-time option for students who need flexibility to balance other responsibilities, such as work, family, or outside commitments. This pathway provides the same high-quality education as our full-time program, but it is designed to accommodate the unique needs of our students. For part-time students, the first 4 or more semesters are conducted virtually, with most of the coursework delivered asynchronously. During the final 3 semesters, the program transitions to a hybrid learning format. Choosing the part time track is a feasible and flexible way to pursue your goal of becoming a family nurse practitioner while maintaining balance in other areas of your life. This is an example of the detailed schedule for full time students and part time students in the last 3 semesters of the program during those intensives or block weeks. Once admitted, students will not be able to access this plan until they have obtained a VUNet ID and password. This detailed schedule illustrates your day-to-day and hour-to-hour activities while you are on campus and attending in-person class sessions. Our clinical placement process is a collaborative effort designed to ensure that you gain the experiences needed to thrive as a family nurse practitioner. This process involves close coordination between you, our FNP faculty, and the clinical placement team to match you with sites that align with your learning needs and your career goals. We offer scheduled informational sessions and regular check-ins throughout the placement process in order to keep you informed and engaged. These touch points help us ensure that your placement meets both program expectations and your professional aspirations. As a part of the admissions process, you will be admitted as a MTA student or Middle Tennessee area student or out of the Middle Tennessee area or OMTA student, and that will guide the next progression of steps. But for students in either category, there is a travel expectation dependent upon the availability of appropriate clinical sites that are closer to you. The Collaborative Academic Practice Program, or CAP, is an excellent opportunity for Vanderbilt FNP students who have a passion for serving rural and medically underserved communities. This grant-funded program is designed to support students who are committed to addressing healthcare disparities and improving access to primary care in these areas. Students participate in the CAP program during the last 2 semesters of their FNP specialty clinical year. CAP also offers significant financial support in the form of scholarships, and this is eligible for both full-time and part-time students. If you're interested in hearing more about it, additional details are listed on VUSN's website and will be shared during orientation and throughout the early semesters of the FNP program. At Vanderbilt, we understand that your career goals may evolve as you progress in your professional journey. That's why we offer seamless transition programs for our FNP graduates who are interested in expanding their expertise or pursuing advanced degrees. We provide several options for continuing your education after completing the FNP program, including the transitions included on this slide and more. These transition pathways allow you to build on to your FNP foundation and gain additional specialization or leadership training without starting from scratch. If you're interested in learning more about the FNP program or other opportunities available at Vanderbilt, we've compiled several resources to guide you. The FNP program website includes a wealth of information and is a great resource for reviewing key details at your convenience. For those considering different specialties, there are individual pages dedicated to each one, outlining program specifics and potential career pathways. The Vanderbilt School of Nursing admissions and tuition or financial aid pages also offer valuable insights into the application process, scholarship opportunities, and funding options to help you plan for your education. Lastly, Vanderbilt's campus resources provide an overview of the comprehensive support available to students, including wellness programs, student organizations, and academic support services. Now that we've covered the key aspects of the FNP program, we are happy to answer your questions to provide clarity and support that you need to move forward confidently in the admissions process. I encourage you to begin your inquiry with the admissions office if you have specific questions about applications, transcripts, or prerequisite requirements, as they can provide detailed guidance on those aspects. But for questions about the program itself, feel free to ask us directly using the email listed on this slide.